Hello, fellow North Dakotans. My name is Dr. Joan Connell, and I'm your Field Medical Officer for the North Dakota Department of Health. Today we learned that we have community spread of COVID-19. Now that's a relatively new concept for us here in North Dakota regarding COVID-19. We understand direct spread in the case where you've been traveling in a place that has a high incidence of COVID-19 and or you're directly exposed to someone sick with COVID-19. However, community spread is a little bit different. Community spread is when there's no known person who's gotten you sick. So a great example of this is when it's flu season, you haven't been exposed to anyone who has influenza, and all of a sudden you wake up with fever, chills, body aches, and you know you've got it. You got it because of community transmission. Now, how do we reduce the rate of community transmission of COVID-19? The same way we do with all the other viruses, only we need to take it more seriously. That way is through social distancing. When we talk about social distancing, we talk about staying at home as much as possible. And when we do need to go out, for example, to get groceries, for example, to get necessary health care, that means we stay a minimum of 6 feet away from the persons around us. Sometimes it's hard to imagine the distance of 6 feet, so I use this jump rope, which can also be used to exercise while you're at home, to illustrate that point. 6 feet is almost the length of my arm span. So we need to keep that distance from every person we're exposed to. When we reduce the rate of transmission by reducing community spread, by staying home, and going out only when absolutely necessary and physically distancing ourselves from the people in our environment, we make a big difference. We save lives, we decrease the rate of spread of COVID-19, and that is an empowering feeling. And I'm asking all of you in North Dakota to embrace that, to take action every time you are out and about, and to be serious about reducing the spread of COVID-19.